Okay, so tonight's session is all about foot pain. And I must admit that it turned into a rather big session once I started preparing it, because I've looked at different parts, all the different parts of the foot, and I decided to stick to the main areas that causes runners trouble and just the most common things I see that can go wrong. Okay, so this is not a list, an exhaustive list of this will cover every single thing, but it is definitely going to cover most of the main things I see in practice for runners. Welcome, my name is Maryke, and I'm the physiotherapist at sportsinjuryphysio.com. If this is your first time here and you would like to learn how to stay injury-free, make sure to subscribe and hit the little bell so that you don't miss any of the updates. What I'll be covering today is I'll look at what injuries you get at the front of your foot most commonly, the inside, the outside, then most common causes for heel pain, and then also over the front of the foot, so more towards the toes side. And I'll look at what type of things can cause tingling or numbness, funny sensations in your feet. And then lastly, I'll cover stress fractures or stress reactions as well. They can happen in different parts of the feet, but I thought that I'll just do them as a whole. And then I've got some lovely questions from the group, and I'm sure that everybody can learn from them, which I'll answer at the end, or some of them I'll answer as we go through. Excellent. So, hi Ali, I see you've joined us. Let me know if you've got any questions as we go along, and if you're watching this on replay, let me know in the comments if you've got any questions as well. Very well, then let's start. So, pain on the outside of the foot. Now, I have decided that the easiest may be if I actually draw on my foot tonight so that you can get an idea of what I'm talking about. So this is the lateral part of the foot, or the outside, and I'm not going to talk about ankle sprains and things today. I'm just going to talk about types of injuries that develop for no reason. You know those annoying injuries that they start as a niggle and they just get worse and worse and worse. That's the type of injury we're going to go talk about today. I'm not talking about acute or traumatic injuries, which is anything where you suddenly develop pain. So for instance, you're running along and you feel a sharp pain under your foot, or you feel a sudden sharp pain in your side of your ankle. That's not going to be covered today. Those type of injuries, it's usually useful if you go see a physio or a doctor or somebody about them. Excellent. So let's get back to the outside of the foot. So this is the lateral foot, or the outside of the foot. Now, the first place where people tend to develop pain, or runners develop pain, is right in that little hollow at the front there. Now, I wonder if I can draw myself. If you can see that this is the ankle bone, the outside of the ankle bone roughly. If you feel just to the front of it, there's a little hollow in there. So if I draw about there, yes, there. And it's roughly where your ankle ligaments run as well. Now, that little hollow's name is the sinus tarsi, and you get something called the sinus tarsi syndrome. And although it's a big name, it's actually not such a weird condition. What happens is, imagine your two bones at the top of your ankle. So your ankle joint's formed by these two guys, tibia, fibula coming down, and then your foot sits with the dome in it. That joint there, this little hole, is actually just the hole where that joint kind of runs along. Now, often, if that joint becomes irritated over time, that becomes inflamed and painful, and that's when you develop pain in that area of the joint. So causes of it, it can be caused by ankle sprain, where you go over on it or you squash it and then afterwards it remains painful. But it's also often caused if your foot rolls too much while you are exercising, because you can see how that's going to put extra strain on your joint. So if you've got pain in the side there and you haven't gone over on your ankle, it's just developed over time, it's very likely that it's sinus tarsi syndrome and it's inflammation and irritation in that joint. So it's obvious from the cause what the fix for this is as well. You've got to look at, do you overpronate? Is it that you've run on terrain that was uneven? Is it that you need a trainer that's got more stability? So are your trainers too flexible? The key to fixing this condition is really giving you enough arch support through the shoes you wear, or even wearing orthotics sometimes, and making sure that you don't have that excessive movement. Then the second common reason for pain on the outside of the foot is your peroneal tendinopathy. Now, your peroneal muscles run on the outside of your foot, and it's the ones that turn your foot out. They are extremely important for stability of your foot. And they are often also the ones that get sprained when you sprain your ankle. Now, I said I wasn't going to talk about ankle sprains, but actually an ankle sprain can often be the instigator, and then the sprain recovers, the ligaments heal, but the muscles are still injured. So going over on your ankle can cause irritation in this muscle, in this tendon. The tendon runs right. There are actually three parts to this muscle group. Two of them run around there, and one attaches to the little knobbly bone there, other one around under the foot, and then you've got a smaller one coming around the front going into that as well. So if you're getting pain along the outside of your ankle in this area, it's likely your peroneal tendons that you've gone and irritated. So what you've got to look out for is, are you running on an incline or a camber where that bit of the foot is strained the whole time? So you're not necessarily straining your ankle, but you're asking that muscle to lengthen the whole time as you're running. Are your trainers worn out, causing the foot to do that more often? Anything that causes excessive motion in that direction will cause that to be irritated. So then we move on to the inside of the foot, or the medial foot. Now, you must have heard of the tib post tendon. I think I've mentioned it a few times in the past. It's really important for arch support, and there's a very interesting thread going on, discussion in the group at the moment about arches and arch support and what can cause injuries to it. The tib post is a muscle that starts from about the middle of the calf there, and then the muscle belly lies there, and the tendon runs and wraps around the back of this ankle bone and comes right under the foot and attaches into there. When it contracts, it turns your foot in, but it also lifts your arch up for you. So you can already see what type of movement will irritate that tendon. Anything where your foot rolls in excessively can cause irritation there. If you've got dropped arches, that can cause irritation as well. If your bum muscles aren't working hard enough, keeping your leg out. Remember, when you're standing on one leg and you do a single leg squat, your knee's meant to move in a straight line. If, however, it turns in while you're moving, then your foot will collapse more, and that will cause more strain on your tib post tendon. The biggest difference, or the biggest thing that people can do to help that if you've got that injury, is to provide your foot with some arch support. It doesn't have to be permanently that you wear orthotics or anything, but you definitely have to provide it with some support that tendon can just start to rest a bit. There are taping techniques and things that you can use as well, and I've actually made a different video of that. I'll put the link in the comments later. But again, just something like supportive trainers with a pair of orthotics that supports your arch. So for those of you who do not know what orthotics are, these are my very grubby worn ones. And it's just, you can see that they've got a little bit of an arch support there. That means that the muscles don't have to work so hard to stop your foot from turning in. You could even get this type of injury if you don't necessarily have a problem with your muscles, but your shoes are too soft, making you turn in more. So a big culprit for that is Nike. They often have trainers where you can really fold them double. That doesn't provide any stability. So unless you're a very rigid person, if you run in those, you will cause yourself some trouble. Another thing that can cause the foot to roll in too much is if you run in a camber. The foot that is on the top may end up having issues if you do that too often. Interestingly enough, also, I managed to give myself that condition a while ago, even with my orthotics. And the problem was, and I knew it was a problem at the beginning, and I was too stingy to buy new trainers, but I bought trainers off the internet, which I didn't try on. They arrived, they were too rigid. I knew they were too rigid, but I was too lazy to send them back, so I ran in them. And At the time, I think I was doing marathon training. It was last year sometime. Now, rigid trainers plus a hard, solid insole, and my feet are extremely flexible, meant that when I've got 2 kilometers downhill to get to my house after I've done a long run. And of course, because it was marathon training, I was tired. I was just plonking down the hill, which meant that with each step I gave, my foot just turned in really quickly. Because this was rigid, my trainer was too rigid, and nothing gave, it made my foot give, which actually caused very quick pronation, which caused my tendons to overwork. So even with the right orthotics in there, because I had the wrong trainers, it was a problem. So if you're getting any pain in that area, there are really loads of facets that you need to think about and consider. Good. So if we move on to the front of the ankle, so let's see, the main culprit here is usually this big old tendon that you can see sticking out there. That is my tib ant, or tibialis anterior, and its main function is to pull my foot up, but also it wraps under there and it helps to support the arch as well. If this guy is weak, it can also cause the tib post to overwork because they both got to do their job properly. But bizarrely enough, the main reason I've seen this flare up in runners is when they tie their laces too tight. So you can imagine if you tie your laces really, really tight over that, you're going to be squashing and grinding that tendon with every step you give. Also, if there's a lot of downhill running involved with that, then that makes it even worse. So if you're getting any niggles in this area, make sure that you check your laces, that they're not too tight. Again, I've given myself pretty much nearly every injury you can talk about in the book. I gave myself a version of that when I was hiking in Scotland a month or so ago. What I did was I was hiking in my trainers because they're the most comfortable thing I've got, and I reckoned if I can do off-road running in them, I can hike in them. But it rained a lot, so they got really soggy. So I thought if I tie them really tightly, my feet won't slip around so much. By the time I realized I tied them too tightly, it was too late, and that was about day 3 or 4 of the hike, and I still had 4 days left of hiking. So the biggest thing that you can do for this type of injury, if you have to continue, is to try and take as much of the aggravating factor off. So what I did was I had to really loosely tie my trainer, nearly no pressure on that, and then I just had to grin and bear it. And I must admit that it took about 3-4 weeks after that of me being really careful with it, nearly not tying my trainer at all and just going for really gentle runs before it settled down fully. So watch out for those, for what you do with your laces. It can really cause you trouble. Yes, so I'll come back to when I speak about stress fractures. There are a few types of stress fractures that you can get on the sides of your feet as well as the front, but I'll discuss them later on. Good, so that takes us on to pain underneath your feet or under the foot. Now, you've got 2 types of things that can cause that, or the main ones is, of course, plantar fasciitis, which most people have heard about, runners, and also dread, and that's usually at its most painful in that bit. If you are getting more pain on there, you've got to wonder if you haven't actually bruised your fat pad. You've got a nice thick old fat pad on your heel, because as you can imagine, it takes a lot of impact, and often if you're a heavy heel striker and you haven't got enough padding there, that can bruise it. But also if you step on a stone or something, that can bruise it, and it can be extremely painful. So if the pain is more there, it may be you've bruised your heel. But if the pain is mostly there and into the foot a bit, then it's likely plantar fasciitis. Now, what is plantar fasciitis? Your plantar fascia is a thick, fibrous tissue that runs under your foot, and it starts from the heel bone and it comes into the toes, kind of splits into the toes, and the main goal is to support your arch. So if you can picture this, imagine this is my foot, and the plantar fascia is underneath it. So if I step on my foot, yes, the muscles and things have to contract to stop it from collapsing, but the main thing that stops it from spreading down and collapsing is the plantar fascia. Fascia is the white stuff in meat. So if you've ever seen raw meat, it's that really thick, sinewy things, and it's extremely strong. It takes quite a bit of effort to strain your plantar fascia, and it's usually things that puts a lot more pressure on it than what it is used to. And it's usually also when you've put it on enough pressure on it for long enough that the muscles in the foot go, we're knackered, we can't help anymore. And as soon as the muscles are tired, then the plantar fascia has to deal with all the strain. So, bizarrely enough for runners, they often upset it with other things in their lives. So things like wearing unsupportive flip-flops or shoes that's really hard can cause it to overstrain, especially if you're used to wearing supportive shoes. If you've gained a lot of weight and you're quite heavy and you then start to run, or you just spend a lot of time on your feet, that can actually cause your plantar fascia to overstrain because you're not used to that. The research also shows that heavier people get it more often. Other things is if you up your training load a lot. So one of my colleagues have actually just given himself a touch of that training for the Beachy Head Marathon. And it is about when your training load gets so high that you don't allow enough of your recovery time, then you're playing with fire and something usually gives. And that's a big cause of the plantar fasciitis as well. Running in minimalist shoes. So again, a guy I saw about 3-4 years ago, he trained in Vibram's 5 fingers. So it's that stuff where there's basically just a bit of rubber. It's like a glove you put on your foot. And he did all his training really sensibly. He never flared anything up while training. And he went and did an ultra marathon. 50 miles, I think it was. Now, he is a big bloke. He's not overweight. He's just a big runner. So he's heavy. And bless him, I saw him afterwards. And he'd given himself plantar fasciitis in both feet. And I think he had tib ant tendinosis as well in both feet. And the main reason was that you can't ever train yourself up to be able to train to the point where you can do an ultra marathon and not get tired. So as soon as his muscles and things got really tired, his feet just said, yeah, we can't contribute to any of this anymore. And because everything else in the legs got tired as well, all the pressure and more pressure started going through the plantar fascia. And that overstrained it. So if you're running a normal supportive trainers, then you stand a chance, because then as soon as the foot says, oh, I can't bear this anymore, and starts to relax, the trainer physically stops it from relaxing into the point where you get the plantar fascia straining. Not always, but sometimes. If you really push it, you may still strain it. So yes, that's a big thing, overtraining. Thinking about, and it's usually people who train for longer distances that end up with that. So there was a question specifically about plantar fasciitis, and let me just quickly see that again. So, how did I not save it onto this one? Okay, I'm going to try and remember it from memory now. It was basically that she's been struggling with plantar fasciitis for a long time now. Some days is better than others, but it still hurts with running. What I would say to that is, with plantar fasciitis, you really want to be pain-free in daily life. So that's walking around, going up and down stairs and things for 4 weeks before you get back to running. And also be able to walk between about 8 and 10 kilometers without flaring anything up in that foot. Then you know you're ready for running. But if you can cope with some runs and not other runs, you've got to ask yourself, are you doing something during the day, just in your normal life, that makes that foot cope with the load better on some days than other days? And it can come down to your work shoes. It can come down to how much time you've got to spend on your feet during that day. Are you running on tired legs versus legs that's been rested? Take note of that, because that's going to be the key to get you back to running properly. It may be that you're just trying to run too often for it at the moment, that it needs a bit more recovery time. Or it can also be that you're just running that little bit too far. You've got to, with this condition, you've got to make your runs to the point where you don't feel it at all. Not during the run, and especially not within the 24 hours after the run. So go and have a look at your training schedule. If you're not having pain every day, then there are things that you're doing that's pushing it into the painful bits, and you've got to cut that back down. But honestly, I often find that it's actually more things like shoes you wear to work or standing up on your feet for long periods during the day that often cause the trouble if you're having your type of plantar fasciitis pain. Okay, so that's my piece about plantar fasciitis. I've done a whole, there are loads of different treatment methods and things that you can use for that. And I've written a whole series of blog posts on it, so I'll post that in the comments later on below, that you can go and have a read about that, because there are definitely different things that works for different people. Okay, then we move on to the front of the foot, and this is also quite a common area for runners to get trouble in. The two most common things that I see or that people complain to me about is, one, pain under the ball of the foot. So if you feel that area, those little bubbly bits or knobbly bits, those are your metatarsal heads. So your metatarsals are the long bones in the front of the foot, and then they attach onto your toe bones, and it's where the toe bones meet them that people often develop pain. The main cause for pain in this area is if it takes more pressure than what it can cope with. Okay, so for runners, that can be if you're running in minimalist shoes, so there's not a lot of padding. And actually, I know minimalist shoes are meant to help you prevent injuries. And while they may be good for things like helping knee pain and things, it puts a lot more strain on your Achilles as well as on the fronts of your feet. And there's research out there that shows that people tend to get a lot of get stress fractures in their metatarsal bones actually from running more onto their feet and also in less supportive shoes. Other things that can cause that problem in that part of the foot or the metatarsalgia is, again, coming back to shoes you wear during your normal daily activities. So for men, I've had it where they flared up with just wearing dress shoes. So again, it's quite a hard sole, and you're commuting to London, walking on hard tarmac the whole time. It may be that this bit of your foot can't cope with it. For females, it's those plimsoll type things or those ballet type shoes. Again, it's sometimes just a piece of cardboard between you and the floor. And honestly, this bit needs a bit more padding than that. How do you fix it? So the docs can do all sorts of injections and things into that. But what I found works really, really well for my patients in clinic is if they switch to extremely soft. I always say, go and find something that feels like marshmallows when you've got it on, that you take absolutely all the pressure off those bones. You're also looking for something that doesn't squash them together. So it's got to be wide enough and it's got to be soft enough when you walk into it. And then you wear those shoes all day long. That's for the plantar fasciitis as well, actually. You need supportive shoes that support that plantar fascia, and you've got to wear it all day long. So usually the people who commute to London moan at me because I make them commute in those shoes. But I tell you what, it's not going to change if you don't take the trigger away. Then that may not be enough for everybody. Something else that can be helpful is if you get an orthotic or an insole that has a metatarsal dome in it. Now, I'm not sure you can see this very well, but maybe you can see there's a little bump in my orthotic there. Now, this bump does not sit on that bit. It sits behind that. And what it does, let me show you, I think I can show you on my foot. What it does is if I press that, can you see at the moment, they're leaning in. So as soon as I press behind them, can you see how I place my toes and everything in a different position? And I just lift those little metatarsal heads off the floor. So using an orthotic that has that little lift in it can be really useful. But I still tell people to combine that with a really soft shoe. Okay. I've looked for examples of that for you on Amazon, and I've popped links to those in the description of this video. so that you can get an idea of what type of things. And to be honest, the one with the metatarsal dome, I was quite surprised, is about £5 you can get it for. I do not know how good they are, or how comfy they are, but yeah, you can't go too far wrong with orthotics if it's not a specialist orthotic that you need. Okay, then I see there's more questions coming through. I'll get to those in a minute. Okay, so the other big thing that sometimes goes hand in hand with this condition is a Morton's neuroma. So Morton's neuroma is basically, you've got, if you can see my toes there, oops, better like that. You've got your bones, your metatarsal bones running there, and then you've got your toe bones sticking in or attaching onto them. Between them, in that gap that you can feel there, you have little nerves running in that gap. And Morton's neuroma is when those nerves become swollen and irritated and really painful. And they can often shoot pain into the toes. They can cause a tingling. They can feel a numb sensation, a burning sensation. And it can be really, really painful. The main culprit for causing that is anything where you wear shoes that squashes the toes together too much, because you can imagine that they're then going to squash that little nerve that's between the toes. Or if you've got a very flexible foot like I have, if when you run your foot moves a lot and the bones squash against each other, rubbing that nerve, that can also cause problems there. So the way we treat Morton's neuroma in clinic is we first try to see if we give that nerve as much space as possible, does it want to calm down? And we do that through getting people to wear really wide shoes, so nothing that squashes it together at all. Again, using an orthotic with a slight metatarsal lift in there. Remember that lift shouldn't sit on the ball of your foot, it sits behind it. That can be useful because it spreads the bones a little bit, so it gives a little bit more space. Often combined with anti-inflammatory type drugs to just get the swelling down. And again, you've got to be in those shoes all day long. So, or barefoot, whatever is the most comfortable for you that doesn't bring the symptoms on, you want to be doing that. If that doesn't work, then our sports docs does a cortisone injection where they go and inject right around that little nerve to get the inflammation to really calm down. But again, after that, it's important to not just go back to the things you were doing, to identify the reason this started and then really address that reason. And that reason will be different for every single person. But yes, first line of defense is give it space, use anti-inflammatories, but check with your doc because anti-inflammatories may not be right for you, and use a metatarsal dome to lift the bones up. But if that doesn't work, it may be worth consulting somebody for a cortisone injection with that. Okay, and that may be, one of the group members said that she was suffering with burning in the soles of her feet when running and that her toes cramp up and go numb. Any ideas how to stop that? So there are a few reasons why you can be developing that. One is definitely to do with the metatarsal bone squashing and whether it's the little nerves that squash between that. So what I've just described is how I would address that. The second is it can be coming from your lower back. So you've got to make sure that you have your lower back checked. Are your nerves possibly causing that? If it's just with running that you're getting it, I would probably think less likely that it's the lower back, more likely that it's a foot issue. How old are your trainers? Do they still have enough cushioning left in them? Is there anything in the trainers that's putting more pressure on that area? Have a look. Hope that gives you some ideas. Then a slightly more tricky one is that she's got pain in the right second toe only, and only when a dorsiflexor bends up, not to pressure, and it's terrible after long runs. So second toe is this one, and it's basically when it does that movement, and it's at the bottom of the toe that it hurts, and it doesn't feel sore when she presses it, but it's painful to bend it up. She thinks this started after wearing flip-flops while on holiday. It's been going on for about 6 weeks. And she did a marathon on the weekend, which wasn't painful, but then after that it now really, really hurts. My first instinct would be that you likely sprained that second toe through wearing flip-flops, and that sprain just hasn't had enough time to recover. And whilst it may have not have hurt during the marathon, that extra strain likely just flared it all up again. How would I treat it? I would definitely not run on it until it's pain-free walking. And then when you do run on it, make sure that you keep your runs a little bit shorter for now and look after that toe. Again, you may find some use in anti-inflammatory drugs, but I'll check with your doctor before you use that to just calm it all down. But yeah, I think you've sprained that metatarsal joint, and it just needs enough time to recover. And because it's toes tend to take a little bit longer because we have to walk on them. So you're looking at something between 8 to 12 weeks if you're lucky with it. But seeing as you could run a marathon on the weekend, it may calm down quickly if you're nice to it again. I hope your training season isn't too full. Okay, then another interesting one. So he's saying that he's got trouble with his left foot. It initially started with an ache in his big toe, which extended to the top of the foot. So if I'm understanding you correctly, it was started at the top of the big toe and came up into the foot. But then that has cleared up now, and the pain have moved, and initially in my heel. So am I right in saying there? But now that it feels more in the arch of the foot. It's sore walking, but not but bearable. And he ran for the first time after 10 days rest last night, and he could feel it, but it was bearable. But then what he later told me was that the run he did 10 days ago was actually a really good time for a half marathon. His fastest time still 8:30-minute miles. Well done, by the way. So that's really good. And it's gotten worse since. And he's also busy. He did do a lot of hills in August, but not really at the moment because he's building up for marathon training. If I listen to this, this sounds to me as if you are busy working that foot too hard and you're not giving it enough recovery time. I think you've got to be careful because at this point you haven't given yourself an injury that won't recover. But if you keep on pushing the pace and pushing the mileage, you will likely get to a point where it's going to become an injury that's going to stop you. So if this was my foot, I would cut the pace as well as the distance down for a while and probably try and keep my fitness up doing non-weight bearing exercise like cycling or swimming, just to give it time to recover, and do slightly shorter runs and easier runs, and maybe see if you run on grass rather than on tarmac, if that helps at all. And then when you start to build the mileage up again, just see, do you need longer rest periods between days? Do you need to structure? What do you need to do with that training of yours that you can give this enough time to recover? Yeah, so without knowing your full training program, I can't really make better suggestions there, but my key would be to go look at your training rather than anything else, because it just sounds as if you've gone from high intensity to even pushing the distance, but pushing the speed as well. And I would put my money on an overuse injury starting to happen here. Good, then let's look at the questions that's come through. I usually run in Asics gel, which is the lighter version of Cayano, and I just had my ACLR and medial menisci done. Okay. Would it make sense to move to Cayano for more cushion, or gel will still be fine? The only injuries I have incurred are ITBS and the one you talk right now under the foot, so plantar fasciitis. Okay, so that is an interesting question. First of all, I do not know my trainers well enough to be able to comment too much on the type of trainer. Let me just read that again. So usually run an Asics gel, lighter version Keanu. Okay. You had your ACL replayed. So ACLR, I'm going to assume that's your ACL ligament, your anterior cruciate ligament, and your medial meniscus done. Are you going for more cushion or gel? And the only injuries you've had is ITBS. And am I correct in saying that you've not had the iliotibial band syndrome recently or the one under the foot recently? It would be useful to know when you had those issues, and is it in the same leg, for instance? If we're thinking purely about your cruciate ligament and your meniscus, then I would say what type of shoe you run in depends on the stability of the whole leg. So if you've got really good single leg squat form in your trainer that you've got at the moment, and you look at if you jump up and down double legs, how you land, if you jump up and down on a single leg, how you land, it may be worth even videoing yourself to see what happens. Does your knee stay in a nice straight line? Does your foot move in excessively? That's the only way that you will know what trainers are right for you. I am going to guess that you did not do your ACL through just running. It would have been football or something that's got a pivoting sport to it. So for the ACL itself, as long as you've got good stability around the hip, good stability around the ankle, it shouldn't matter too much what you put in your feet. Both of those, both the gel as well as the other one, will give you some cushioning, so it's not totally rigid shoes. I think that should be fine. But I would test your stability in that, and video yourself and see how you look. That's the only way you're going to know. Excellent. Hi Susan, I'm glad you joined us. So I hope that's answered all the questions, that I haven't forgotten any. If you've got any questions afterwards, or you feel I wasn't quite clear, you're welcome to message me, or you're welcome to just pop it in the comments. And yeah, happy running. Take care. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.